Hey everyone, I'm Dr. Jacobson, your go-to board-certified plastic surgeon right here in sunny Beverly Hills. Buckle up because in my practice, I've seen it all. From jaw-dropping transformations to some truly unforgettable procedures. It's been quite the journey and I can't wait to share it with you. Join me on the Beauty Blueprint, where we'll dive into cutting-edge procedures and techniques in the world of cosmetic plastic surgery and explore everything you need to know about the overall health and wellness. But that's not all. I've lined up some exciting guests who will share their insights on various aspects of health and beauty, making every single episode packed with valuable information and fun discussions. So grab your coffee and get ready to join the conversation every Sunday morning at 7:30 a.m. right here on Go Country 105. You won't want to miss a moment. All right, good morning, Go Country 105 listeners. We're back. I'm Dr. Joshua Jacobson, your beauty architect, here with another episode of Beauty Blueprint. Thanks for listening. I'm here with my lovely co-host, Ashley, here with me. Go ahead, Ashley.
Good morning, everyone, and welcome to this week's Beauty Blueprint episode, where we're talking about all things post-baby transformation. Dr. Jacobson, tell me, how common is the surgery request?
It is very, very common because most women obviously have children and they have multiple children, and that really changes your body. Usually if you have only one child and it's kind of small, it might not really change much, but if you have multiple children, that really stretches your skin. And that stretched skin cannot be removed with, that stretched skin cannot be taken care of with exercise or diet because it's just loose skin. Obviously, sometimes you may gain some weight with that, and we'll talk a little bit more about that during the show. But this is one of the most rewarding surgeries for me and for our patients, and it really gives back the body they used to have before children. And they always say, no one told me if I have children these things would happen and my body would change. And so that's why we're here to undo all that change that happened during pregnancy and breastfeeding.
Well, before we get into today's show, we have a little game that we like to play that's called Would You Rather. Okay, Dr. Jacobson, you're up first. Would you rather have the ability to instantly change your outfit to anything you want anytime, or be stuck in the same outfit forever, but have an invisible cloak that makes you completely undetectable?
I would really like that invisibility cloak. Okay, your turn, Ashley. Would you rather have to give up coffee or give up eating sweets?
Well, as we know in this practice, everybody knows not to give me any coffee. I have natural energy where if I do have a cup of coffee, you might need to put me in a straitjacket. I will be bouncing off the walls. So I would say absolutely, giving up eating sweets. I have been on a sweet tooth kick, so yeah, I don't want to give up my sweets. Definitely don't give me any coffee, or that won't be good.
Okay. Good to know. I guess I hope you like those phone nuts we got for your birthday.
Oh, I love those donuts, those phone nuts. Oh, those were fabulous. Thank you again for those.
Yeah, of course. One more for you, Ashley. Would you rather have a perfect memory or perfect eyesight?
Well, we all know how bad my memory has been lately, so I will go with memory. After sometimes talking to 20, 30 patients a day, I can't remember whose story was what, whose name goes with what story, which person wants what. God, I would die for a perfect memory. Yeah, I would die.
Well, that's also why afterwards we debrief and we go through our notes.
We do. So please, anything. I would do a perfect memory.
All right, sounds good. Well, we'll tell the genie.
Yes, thank you. Please do. Well, those were great. All right, let's get into our show. So tell me, Dr. Jacobson, when is it safe to have plastic surgery after giving birth?
So, from a medical standpoint, having surgery after giving birth can be done about a month or two after, from a medical standpoint, from a safety standpoint. But in terms of when is ideal, ideal to have plastic surgery after having a baby, usually it's about 6 months to a year, because we want your body to bounce back to how it's supposed to be and kind of stabilize. Your weight stabilizes, the changes in your body stabilize. And also, if you're still breastfeeding and you want to have breast surgery, those two don't go together. So we want you to wait. But I would say wait at least 6 months, 6 to 12 months. But I always tell patients, come in for consultation anytime you want, anytime you're thinking about it, just so we can advise you when to come back, what to do, how to prepare. It's never too early to have a consultation. Always just give us a call, 424-465-3800. That's 424-465-3800. You'll hear Ashley's beautiful voice. She'll spend so much time with you on the phone and counsel you. It's never too early to have a consultation.
I also want to add one thing as a patient coordinator for this, and this is something that I love to add to any of my new mommies. They have to think about, if they are going to have a tummy tuck, they are going to be sewn up so tight in the incision, they're going to be walking bent over for a little bit. If they have little ones that they need to pick up, we always say no heavy lifting for a while. They're going to be bent over for a little bit. It's going to be very hard when you have a little one that needs to be taken care of. So I think that that's something that we really do have to always take into consideration as a new mom.
Yes, that's absolutely correct. Thank you for mentioning that. And that's why I tell you, have a consultation as early as possible so you can plan all of these for when time comes. We've had patients who, hire caretakers, or they have their family members come into town to help them with the babies, but you need preparation for those.
Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. Are there any specific risks associated with having plastic surgery after childbirth?
So, other than just the regular typical risks of surgery, which are minimal, there is no specific risk associated with that, especially if you're doing it a month after. Obviously, if you do it soon after your pregnancy, like 2 weeks after, your risk is in general elevated just because your body is going through so many changes. But obviously, we don't do surgery that early.
Got it. Well, okay, so now 2 questions here. Does breastfeeding affect the ability to have surgery?
So it does not. If you've had if you've breastfed before, you can still have surgery. But if you're currently breastfeeding, we don't want to be doing surgery on your breasts.
Okay, and then maybe this is a personal question just for myself, but knowing that I have not had my babies yet and I do have breast implants, can new moms breastfeed with implants in their body?
That's a very good question and very common question. So here's what the data shows. In general, there are 30% of women out there that cannot breastfeed. That ratio stays the same after you get breast augmentation. So if you weren't going to be able to breastfeed naturally, that'll stay the same after breast augmentation. We've had plenty of patients who breastfed after getting breast implants.
Got it. Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800. What are the most common types of plastic surgery procedures for postpartum women?
All right, good question. So, this term that we call a mommy makeover, which is very common term that's thrown around, and it's very, very heterogeneous. Now, the textbook definition of that is a tummy tuck, breast lift with an implant. That's just what the textbooks say, a mommy makeover. However, after having children and breastfeeding, some changes that happen in your body may or may not require these surgeries. For example, if there are women who breastfed and they don't have any saggy breasts, so they might not need a lift. There are some women who, after breastfeeding, had a lot of sagginess of their breasts, but they have a lot of volume, so they might just need a breast lift. There are a lot of people who just lump multiple surgeries together and they call it mommy makeover. For example, I've seen people say, oh, it's just lipo, tummy tuck, and a BBL, or it's just a breast aug and a tummy tuck. So it's a heterogeneous kind of group of surgeries. It's mainly to counter all the changes that your body went through after pregnancy and breastfeeding, which is your breast getting smaller, saggier, your abdominal skin stretching, some of the fat depositing in your abdomen.
Got it. When I have a lot of consultations over the phone, and a lot of mommies call me and say, well, what does this include? I'm like, well, what do you need? Tell me what you're looking for, and how can we get your body to where it used to be before you had your baby? And it always seems to be a little different. So thank you for explaining that.
Exactly. Very good. Very good. So one of the important things that the surgery includes, and it should include, which I don't think every plastic surgeon does, is sewing back the muscles. So you've shown me, you've seen me show this diagram to patients where your ab muscles are together before pregnancy and then they separate. You know that little line in between the ab muscles? Mm-hmm. That stretches, and that's called fascia, and it stretches, and you get what we call rectus diastasis, which means separation of the abdominal muscles. Now, if let's say you take off all the skin from your belly and all the fat from your belly, but you don't sew that muscle, you won't get a flat abdomen. So during a tummy tuck, we sew those muscles back together with permanent sutures so that they don't dissolve and they don't go away. And that really brings those muscles back together. It makes your belly flatter, and it brings your waist in. And that really undoes the stretching of the muscle that happened during pregnancy. Then the other step is removing all that extra skin that got stretched during pregnancy. A lot of people, a lot of times people may have stretch marks that happen as a result of that. A lot of that stretch mark can be removed during the surgery. Some of it cannot. Obviously, it just depends on where the stretch marks are and how much of it you have. And the other part is, which I always like to include, is at least a little bit of liposuction. Everyone can use a little bit of liposuction. It's like condiment to plastic surgery.
Yes, it is.
That happens because our body just likes to store fat in certain areas. Even if you lose all the fat that you gained, your body resets where it wants to be in terms of its weight, and it'll try to pull you back where it is. So a lot of times people say, I gained 200 pounds. The first 150, 180 was so easy. I just dropped it like this. But then the last 20 pounds was so hard. And that's because your body first is helping you get to that equilibrium point that it wants you to be. But then once you get there, it kind of wants to keep you there. So you, even if you go below that point, let's say you lose 10 pounds below that, you eat a donut, all of a sudden you go above. Just because your body changes its metabolism to adjust to that.
Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040. And leave a message with your comment or question, and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
So, more about me here. So I am 38, I want to have my baby soon. How can I prepare my body and my mind for plastic surgery post-pregnancy? What would you suggest, Doc?
So one thing is, after pregnancy and breastfeeding, what we want is for you to be done with breastfeeding. We want your weight to be stable. That's one of the things that I emphasize to patients. If you're gonna lose weight, try to lose weight, but in a healthy way, not in a drastic way, because your body will gain it back afterwards.
So no more crash dieting?
No,
not at
all.
Okay.
Not at all. No. So obviously your regular diet and exercise, and once you're done breastfeeding, once you make sure you have someone that's able to take care of your kids, that's able to be with you after surgery, and also it's very important to have the support of your family, be it your partner, your husband, or your parents. It's important because surgery is a lot of transformation. Your body goes through a lot of changes, and you need a lot of help. You need a lot of support. So that's very important to have.
Okay, and so now with my mind, or with the patient's mind, a lot of A lot of pregnant women after giving birth go through postpartum depression. Do you screen for that? Do you feel like you maybe shouldn't operate on anybody going through postpartum depression? Do you give them time to get over that? What do you suggest doing for anybody going through postpartum depression?
Absolutely, that's a great question. So if you have depression, it can only get worse after surgery just because of the changes in your body. So if I see someone has any signs of postpartum depression, or they're still having difficulty adjusting to having a new child, I recommend they go see a psychiatrist first before taking on surgery.
Got it. That's good to know. Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. Let's say we have a patient come in who had plastic surgery and then gets pregnant again. How does that affect it, and what would you do?
Well, so one of the things that I want to make sure, one of the misconceptions that I want to make sure I address is, if you have a tummy tuck, you can still get pregnant afterwards. It's not a contraindication. So that's first off. Now, but if you do get pregnant, everything that happened before will happen again. Your muscles will separate, your skin will stretch, and obviously we can do a redo tummy tuck afterwards to undo all of these changes, but essentially you undo all of that tummy tuck work that we did the first time.
Got it. Now, a lot of patients ask me, and I'm not sure where the misconception comes through, but they say, well, I had C-sections. I don't have separation of the ab muscles. Why do patients feel like they don't have separation of the ab muscles if they've had C-sections?
It's a good question. So I've actually heard that from people who've had C-section and who haven't. On the internet, there's a lot of this talk where you put your finger on your belly and you feel something separating, you feel whatever lines and that sort of thing. If you have a very severe degree of muscle separation, then yes, you will feel it that way. But most of the time, you will not be able to feel it because it's only stretched moderately, and it's not just that area between the muscle, but also the muscles itself that are stretched. So you're not always able to feel that muscle separation by your fingers on your skin. That's why when I do these tummy tucks, I take pictures during the surgery from the time before I saw the muscle and after, and I show the patients how much I was able to bring the muscles back together, because you're not able to feel it over the skin.
You know, that makes a lot of sense now. I got a call from a patient say, well, I did the finger test and I got 4 fingers, but I should be 2. And I was like, what finger test? I'm so confused. Like, why don't you come in for a consultation and have the doctor see how I separated your abs? Or I didn't know what they were talking about, but thank you for explaining that to me.
Yeah, all from Dr. Internet.
Yeah, Dr. Internet, that's so funny. Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800. What are the potential effects of surgery on the patient's ability to care for their baby?
Good question. So after a tummy tuck or any breast work, we don't want the patients to do any heavy lifting, which is more than 10 pounds. And that's for about 6 weeks or so, because we want everything to heal before we put stress on them. So most of the time they have children who are more than 10 pounds, and they cannot be lifting those children, they cannot be pushing heavy strollers, and they cannot be doing any of those heavy strenuous activities. So if you're gonna be getting the surgery, make sure you plan for having help with your children afterwards for at least 6 weeks.
Got it. And I'd also like to add, because we're going through this with a patient right now, she has children that are a little bit older, and she can't drive for a long time in order to take her older children to school. And so finding a ride for her older children too after this is a big deal as well. And that's always something you want to keep in mind.
Yes, that's right. So driving varies depending on how your body is healing. We usually don't want you to be sore when you're driving, just because if in case you need to make a sudden turn, we want you to be able to do that. So it changes from a person to person. Sometimes it takes a week, sometimes 2 weeks, less or more. It just depends. It's case by case basis.
Got it. What kind of recovery time should I expect after surgery? And how might it be impacted by having recently given birth?
If you recently gave birth, I want you to wait a few months until your body snaps back to how it wants to be before we do your surgery. But in terms of your recovery, you're going to have a little bit of soreness and some discomfort for a few days, and you're going to be walking bent down for at least 2 weeks. And that's because we pull the skin really tight so you can get a really flat abdomen. Obviously, we can not do that and you'll still have loose skin and you'll just walk straight. You know, I've had patients who say, oh, well, my friend got surgery from this other plastic surgeon and they walked straight the next day. Well, they probably didn't take enough skin.
Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040 and leave a message with your comment or question and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
Now, a lot of things happen during childbirth, one being an umbilical hernia. Is that something you could fix in a mommy makeover as well?
Good question. So, an umbilical hernia, you can either be born with it or you can develop it during pregnancy. If it's a very small, mild umbilical hernia, it can be fixed during that muscle repair because it's part of that muscle separation. But if it's larger than that, we usually have you get it repaired by someone that specializes in that, a general surgeon, a hernia surgeon, and then get your surgery done. If you're wondering about that and you're looking to plan for that, call us at 424-465-3800. That's 424-465-3800, and we'll be happy to counsel you as to how to deal with that, whether you need to get that fixed first or we can get that fixed for you.
Got it. Are you ready to achieve the body you've always dreamed of? Look no further than board-certified plastic surgeon Dr. Joshua Jacobson. Dr. Joshua Jacobson offers a range of surgical procedures to help you look and feel your best. From breast augmentation to tummy tucks, our skilled team will work with you to create a personalized treatment plan designed to meet your individual needs and goals. Let us help you achieve the confidence and beauty you deserve. Don't wait. Contact us today at 424-465-3800. That's 424-465-3800. One more question for you. During childbirth, or during pregnancy and during childbirth, two things happen. One is stretch marks, and other is if I were to give, or our patients were to give birth and have a C-section, can you get rid of the C-section scar, and can you get rid of the stretch marks as well when you do the mommy makeover?
So those are very common questions. C-section scar, almost always we're able to get rid of it because my scars are pretty much almost always under the C-section scar. They come pretty low so you can hide them under your bikini. Stretch marks. Now, when we do a tummy tuck, we remove any skin that's from your belly button all the way to your pubic area, which is pretty much where the C-section scar is. So if there's stretch marks there, we can remove it. If it's anywhere above that, usually it's not. We can't remove it unless you have a lot of loose skin, but which is not the case for most patients. But there are non-invasive things that we can do for them after surgery once they heal. For example, radiofrequency microneedling that helps a lot with getting rid of that stretch mark.
Got it. Okay, and so now also with your tummy tucks for mommy makeovers, the mom's pubis area, the fupa, what do you do for that for a new mom?
So, that's one of the areas that's a lot of times overlooked. you do collect some fat in that area and also lose skin. That area stretches. So during tummy tuck, what I do is liposuction that area as well to take out some of that fat so it matches the top area where we liposuction and stretched. And I also take out any stretched skin in that area so it becomes the same size as it would have been naturally before you had children. So that fupa should not be there after a tummy tuck. It's part and parcel of a tummy tuck.
Got it. So they get they get the vasal liposuction and a pubic lift as well.
Yes, absolutely.
Got it. Perfect. Ever wish you could redesign your look even just a little? Meet board-certified plastic surgeon Dr. Joshua Jacobson, the architect of beauty. His expertise transforms your vision into reality. Whether you're dreaming of a subtle enhancement or a dramatic change, Dr. Joshua Jacobson can meticulously blueprint your ideal self. Don't wait, contact us today at 424-465-3800. That's 424-465-3800. Okay, so a little off topic, I wanted to ask you, what is we'll touch on our trending episode later, but what is the common trend that you're seeing right now with plastic surgeries?
Very interesting question. So I know in the 90s, there was a trend of having a really large breast, kind of like Pamela Anderson look. And in the 2000s, we started having a trend of having a very large butt and large hips. Now we've kind of gone the other way where a lot of patients want a more natural look. They say, I want it to be noticeable, but I don't want people to think I had surgery, or I don't want it to be too big, too out of proportion. That goes same with their breast and their buttocks and even their waist. They say, don't make it so tiny that it looks like I had work done.
Got it. Well, ab etching became a thing.
Yes, ab etching has become a thing. The only downside with that is if you do gain weight, then it kind of messes the whole thing.
Got it. Okay. Well, I know from seeing that your BBLs right now, a lot of our patients are coming in and saying, I don't want to look like I have a huge buttocks. I don't want to look too fake. What can we do? And I want to say, Dr. Jacobson, you do a really phenomenal job on just doing the fat transfer and just contouring, making the butt look more round, more projected, more natural. And I think that's the biggest trend that I see right now with BBLs.
Yeah, that's true. And actually another trend is getting their BBLs reversed. So there are patients who are coming in and they want their buttocks made smaller, their hips smaller, because they just say it's oversized.
Yeah, I see that too. Yeah.
Yeah, and one thing that they should know is, as I mentioned, if you're gonna gain weight, do it before your surgery. Do not gain weight after your surgery, because then everything changes. All the proportions we created, all the fat. So for example, I've had patients who had BBL and then they gained 10-15 pounds after that, and then their butt got really large, and now they want to get it reduced. That's because fat doesn't know where it came. Fat doesn't care where it is. It just cares where it came from. If you used to gain your fat in your belly, and now all that fat cell is in your buttocks, now your buttocks get bigger. So if you're gonna gain weight, do it before your surgery. I don't want you to go on a drastic diet before your surgery, no matter what it is, whether it's tummy tuck, it's liposuction, it's facelift, it's BBL. I want you to be at a level that you can easily maintain.
Good to know.
Do you have questions you would like answered on the Beauty Blueprint? Call us at 800-734-0040. That's 800-734-0040, and leave a message with your comment or question, and we will answer it on air. Then tune in every Sunday morning at 7:30 to the Beauty Blueprint right here on Go Country 105.
Well, it's already time to end our show.
I hope you enjoy listening to our show. As always, make sure to tune in every Sunday at 7:30 a.m. on Go Country 105 FM to listen for everything you need to know about plastic surgery. And if you want to have anything done, make sure to call us at 424-465-3800. That's 424-465-3800. Also, we have many more exciting topics coming up. Make sure to stay tuned in. 7:30 a.m. Go Country 105 every Sunday morning. Also, make sure you follow us on Instagram at Josh Jacobson MD. See you next time, same place. I'm Dr. Joshua Jacobson, your beauty architect.